Health for all means a more responsive and equitable global health ecosystem. Only once everyone has access to quality health services will we be able to save more lives from diseases like malaria and COVID-19 and prevent future global health emergencies.
Health for all means we put people first. It means we invest in equity, providing access to care and financial protection to every inhabitant of our country, irrespective of their official status. Because a country and its economy can only thrive when its people are healthy, both physically and mentally.
Health for all means affordable, accessible and high-quality medical care, modern systems of epidemiological forecasting and response, domestic productions of drug and medical products, healthy lifestyle and mass sports. Kazakhstan defined these 4 directions as our national priorities for the 5 upcoming years.
Health for all begins at home, in schools, in workplaces, and everywhere, for all people, for all well-being, by all sectors of society. No one is left behind.
Health for all means valuing every life equally, regardless of wealth or race, sexual orientation, gender, physical ability, or social status. Because health is not just the absence of disease, but it's the presence of dignity and well-being in every sense of the word.
Health for all means securing the highest attainable standards of health as a fundamental right of every human being, ensuring equity and not leaving anyone's health behind. Universal health coverage is a powerful mechanism for achieving better health, well-being and the path to promoting human development.
Health for all means ensuring everyone, everywhere can access the services they need when they need them. To me, this means working closely with local and community leaders to determine those needs.
Health for all means ensuring diverse and equitable leadership. While women make up the majority of health workers, they are far from equal participants in decision-making. To help build equitable and resilient health systems, invest in women leaders. Our knowledge, perspectives, and equal participation in decision-making are essential to building health for all a reality everywhere, including at the front line in communities during the COVID-19 pandemic and beyond.
Health for all means and requires us all to work more effectively together in order to ensure that each person receives quality health care when and where they need it. It means making the most of limited resources, protecting the rights and dignity of people across the life course approach, ensuring that UHC delivers for women, children, and adolescents. UHC leaves no one behind.
Health for all means viewing health as an investment rather than a cost. It means we prioritize health in all policies and commit to strengthen our health systems to ensure that they are equitable, resilient, and capable of meeting everyone's needs without financial hardship.
Health for all means a world where all people thrive and not just survive. For people and communities who are marginalized and in vulnerable situations, this is often not an option. But frontline health workers and volunteers can make a difference by providing trusted, life-saving healthcare. Without them, there is no universal health coverage.
Health for all means just what it says, for all, not just for the rich, not just for the powerful, but for everybody. We can do it.
Health for all means that countries have strong and resilient health systems to ensure health security for all and access for all to essential health care without suffering financial hardship. Universal health coverage is the foundation for human capital and economic growth and the driving force behind all of the World Bank's health investments and efforts with the countries.
Health for all means holding government leaders accountable. They have primary responsibility for ensuring everyone everywhere has access to quality essential health services without suffering financial hardship. This UHC Day, let's remind them health is an investment, not a cost. and that investing in equitable and resilient health systems is the most efficient and sustainable way to reach universal health coverage and health security goals.
Health for all means combining forces to promote health and well-being for everyone, everywhere. We know by now that nobody is safe until everyone is safe. So let's work together in solidarity to make the best use of our limited resources and ensure that no one's health is left behind.
Health for all means everyone should have a say in how much public fund is spent for health and how the money is spent.
Health for all means ensuring fair access to care for people everywhere. We cannot accept the setbacks of our efforts to end the global TB epidemic by 2030, caused by COVID-19, become a permanent trend. We will not give up. But let's work together to ensure that everyone, everywhere, including people with TB, receive the care they need, when they need, and where they need it.
Health for all means ensuring equal access to high quality, safe and people-centered healthcare services based on individual needs and with no distinction of gender, sexual orientation, race, religion, political belief, economic or social condition.
Saúde para todos significa assegurar o direito de todo cidadão a medicamentos e serviços de saúde. Aqui no Brasil, a saúde é um direito fundamental, é direito de todos e dever do Estado. Reitero o nosso compromisso com a cobertura universal de saúde. Viva o nosso SUS!
Health for all means we have strong parliamentary institutions and empowered parliamentarians upholding the rights of all citizens. This is why the Interparliamentary Union is investing in parliaments as agents of change. Our vision is a world in which the health and well-being of people guides action at all levels of government.
Health for all means what global leaders committed to in the 2019 political declaration on UHC, which is to leave no one behind. And we know that progress in health means progress in every area of sustainable development, and we cannot afford to wait any longer. It is a matter of political will, and it is our responsibility to the people we serve.
Health for all means promoting right to health by acting on the environmental and social determinants of health and providing access to equitable, universal health systems.
Health for all to me means that all people, in particular those affected by war and violence where health institutions have been damaged, have access to health services. In particular, those in refugee camps, those in detention, those outside of state control. We have to work together so that everywhere and everybody has access to health services.
As a health worker, I would like everyone to have access to affordable, quality health services as a human right based on equity and gender equality, ensuring that all genders across their life course have access to gender-responsive universal health coverage to meet their health needs.
Health for all means people-centered health systems that provide the right services, remove barriers to access, reduce inequities, and improve quality.
Health for all means reaching those left furthest behind with life-saving vaccines as a pathway to providing other services. As countries roll out COVID-19 vaccines, we have a historic opportunity to strengthen routine immunization, to reach zero-dose children and missed communities with a full course of vaccines, along with primary healthcare services, and build resilience to future shocks.
Health for all is a beacon of light, freedom from inequality, a world full of hope, compassion, and peace.
For every individual to lead a full and fulfilling life, we need an efficient and equitable health system to provide appropriate and affordable health services all along the life course. A system of universal health coverage, which ensures that those services are available while also linking up with the social determinants of health that can promote and protect health even through other sectors is essential for every country to achieve.
La santé pour toutes et tous, c'est être solidaire et accompagner les pays dans le renforcement de leur système de santé. Chacun et chacune, peu importe son âge, son sexe, son niveau de vie ou son lieu de résidence, doit avoir accès à des soins de santé de qualité.
Health for all means saving lives by investing and providing quality, accessible, and resilient health systems to every citizen. Health for all means leaving no one's health behind.
Health for all is more than just the health services. Physical, mental, and social well-being can only be achieved through a multi-sectoral and multi-stakeholder approach. So people at any age, in any given country, can live productive lives free from non-communicable diseases.
Health for all means that health is not a luxury for those who can afford it. It is a fundamental human right. One of the best ways for countries to protect and promote that right is by putting it in their constitution. More than half of countries have done that. WHO calls on all countries to make the right to health not just an idea or an aspiration, but a legal guarantee.
Health for all means investment and collaboration within and beyond the health sector to address the structural, social, and economic inequalities that continue to widen. Inequalities are not inevitable. We must invest in robust, equity-oriented, gender-responsive, rights-based health systems that ensure physical and mental health coverage, particularly for groups and populations that are furthest behind.
Health for all means protecting people, especially for the poor and those who are vulnerable or in vulnerable situations, so that no one's health is left behind. Health services must be equitable and inclusive in order to ensure that everyone, everywhere can access to health services they need. After all, we all are in this together.
Health for all means working together to build strong, resilient and inclusive health systems that work for everyone. Working with our partners, the UK has improved access to health services for around 9.5 million people in DRC and 1.3 million women and children in Ghana, and helped to halve the maternal mortality rate in Nepal. Later this month, I will launch 2 new papers that set out how the FCDO will continue our work to achieve universal health coverage and end the preventable deaths of mothers, babies and children.
Health for all means that in all countries, including my home country, Uganda, no mother will have to choose between putting food on the table and getting treatment for her sick child. It also means that adolescent girls and young women can have sexual and reproductive health services to meet their needs, and that men who have sex with men can enjoy the same health services as everybody else. It means communities in their diversity are able to contribute as planners, as implementers, and as monitors of health services.
Everyone, children, women, and men, all over the planet must have access to health care. The disastrous impact of the COVID-19 pandemic on our societies has really shown the importance of resilient health systems, and they are key to achieving universal health coverage and health security, and should be a priority for every WHO member state.